Have you ever wondered what rheumatoid arthritis is? Let's dive right in. Rheumatoid arthritis, or RA, is a chronic inflammatory disorder that goes beyond just affecting your joints. This condition is an autoimmune disease, a scenario where your body's immune system turns against its own tissues, mistakenly identifying them as threats. This misdirected attack leads to inflammation, pain, and can eventually cause bone erosion and joint deformity. So that's a brief introduction to rheumatoid arthritis. But what exactly happens in our body? You might be wondering, how does one realize they have rheumatoid arthritis? Well, the symptoms can be quite varied and inconsistent, often coming and going in what we call flares. One of the earliest signs is discomfort and swelling in smaller joints, like those in our fingers and toes. As the disease progresses, these symptoms can extend to larger joints such as the wrists, knees, ankles, elbows, hips, and shoulders. But that's not all. Rheumatoid arthritis is a systemic disease, affecting more than just your joints. Roughly 40% of individuals with this condition also experience symptoms in other areas of the body. This might manifest as dryness of the eyes and mouth, shortness of breath, or even inflammation of blood vessels. The intensity of these symptoms can range from mild to severe, and they can appear or vanish unpredictably. This inconsistency often makes rheumatoid arthritis a tricky disease to diagnose. Understanding these symptoms is essential for early detection. But what causes this disease? Now that we know the symptoms, let's delve into the causes. This enigmatic inflammatory disorder is often chalked up to a curious interplay of genetic and environmental factors. However, the exact cause remains a mystery to the medical world. What we do know is that it's an autoimmune condition. This means that the body's immune system, which normally protects us from harmful invasions, gets a bit confused. It starts to see the body's own tissues, particularly the lining of the joints, as foreign invaders and attacks them. This leads to inflammation, pain, and over time can cause bone erosion and joint deformity. Genetics also play a significant role. If you have a family history of rheumatoid arthritis, your odds of developing the disease are higher. However, having the genes doesn't necessarily mean you'll get the disease. It's like being dealt a hand of cards. You might have a few high ones, but it still depends on how the game unfolds. And then there are the environmental triggers. Certain exposures such as black mold, gut microbiome dysregulation, and candida overgrowth could potentially kickstart this autoimmune response in people with a genetic predisposition. Now let's talk about the treatment options available. If someone is diagnosed with rheumatoid arthritis, what are their options? The mainstream Western medical treatments for RA focuses primarily on controlling symptoms and slowing down the progression of joint damage with pharmaceutical drugs. They believe there is no definitive cure for this disease. More often than not, they misdiagnose autoimmune diseases because they fail to find the root cause of what is truly responsible for creating the disease in the first place. Their method of treatment is always medication. Doctors often prescribe disease-modifying anti-rheumatic drugs or DMARDs, which work by interfering with the immune system's attack on the joints for a temporary relief. This will only slow the progression of the disease and oftentimes comes with extreme side effects. Biologic agents, another subset of DMARDs, target various protein molecules involved in the immune response. These are prescribed for people who don't respond to traditional DMARDs. Additionally, short-term relief might be found in non-steroidal anti-inflammatory drugs and corticosteroids. In severe cases where joints are significantly damaged, Western doctors will always push for surgery. Thankfully, there is a holistic approach to actually curing rheumatoid arthritis by testing for the root cause and adjusting the person's diet, addressing what the person is eating, watching, listening to, and what external influences they are exposing themselves to. Physical therapy is another crucial component of a comprehensive holistic treatment plan. Specific exercises will help keep joints flexible and muscles strong, which in turn can improve balance and reduce pain. It's crucial to understand there is no quick fix or a pill that one can take to cure a disease of such nature, but that certainly doesn't mean there isn't a cure. Our bodies are incredibly complex and self-healing instruments,
There is a cure to any disease you can think of. So, although rheumatoid arthritis is a serious disease, there is hope of completely reversing your condition. Find a holistic doctor who won't simply diagnose your symptoms, but one who's determined to figure out the root cause and create a dietary protocol to cure you.
Early detection and treatment can make a world of a difference in managing this condition. If you have persistent joint discomfort and swelling, it's important to see a doctor. We strongly recommend a holistic one. Want to learn more about fascinating topics like this? Subscribe to our channel for more lessons on the human biology.